You're telling me it's 2026 and you still don't know how to give your dog CPR? Well, you're not the only one, because 75 to 90% of pet owners don't know how to give their pets emergency first aid, but I'm on a mission to change that. If you find your dog collapsed and unresponsive, remember these three things: A, B and C. A is for airway. Take a look inside your dog's mouth. Is their airway clear? If there's anything obstructing their airway, you need to get it out. And I have got a separate video showing you what to do if your dog's choking and how to perform the Heimlich manoeuvre. B is for breathing. You need to check whether your dog is breathing. So get down to eye level with their chest and watch their rib cage. Can you see it rising and falling? If not, can you feel their breath on your cheek? And check their gum colour. Are they going a shade of blue or purple? Just take care during these steps not to get bitten. C is for circulation. You need to check whether your dog has a heartbeat. If you're not sure where your dog's heart is, take their elbow and move it back to touch their chest. Just below that area is generally where your dog's heart should be. If there's no heartbeat and they're not breathing, you need to start CPR. Call the vet to alert them of the situation. They might be able to give you some advice, but make sure your dog is laying on a flat, hard surface on their right-hand side. Extend their neck and move any of their limbs out of the way. You're going to be using the heel of the palm of your hand, so interlock your fingers, lock your elbows straight, and place your shoulders directly above the area where you're going to give the compressions. Now, for dogs over 7 kilos, there are 3 different places that you will need to place your hands depending on what chest type they have. Firstly, if you have a round-chested dog like a Labrador, Springer Spaniel, a Beagle, they tend to have a bit of a dome here on their chest. This is where you need to give compressions at the widest point of the rib cage. Secondly, if you have got a deep or a keeled chested dog like a German Shepherd or a Greyhound, where they have got a particularly deep set chest, you need to give the compressions directly above the heart, which is just behind their elbow. And thirdly, if you have got a wide or a barrel chested dog like a French Bulldog or an English Bulldog, you need to place them on their back and give compressions directly in the middle of their sternum. I'm going to continue this demonstration as if it's a deep chested dog. You need to give 30 compressions at a rate of 2 compressions a second. That's 120 compressions a minute, and you need to compress the chest a third to a half of the dog's entire chest depth. Once you've given the 30 compressions, you then need to give 2 breaths. Place the dog's tongue inside the mouth, wrap your hands around it, and blow gently twice into the nose. Watch the rib cage rising and falling to make sure you're delivering sufficient oxygen. As soon as you've done that, straight back into your compressions. Give 30 compressions, then back to 2 breaths. You need to keep cycling between the 30 compressions and the 2 breaths for a minimum of 2 minutes. After 2 minutes, you can pause to see if there are any signs of life. Is your dog breathing for themselves? Can you feel a heartbeat? If you cannot feel a heartbeat or they're not breathing, continue the CPR. If you can feel a heartbeat or you can see that they're breathing, fantastic. Get them off to the vets as soon as possible. CPR is an essential skill that every pet owner should know. It could save a life, so don't forget to drop me a follow, save this video, and please repost it.